I'd like to tell you a story. The story is about a 10-month-old girl named Ellie, and she developed normally, started to speak, but at 21 months old, she stopped speaking and started becoming fixated on lights and sounds and other things that normal children aren't fixated on. Her parents soon found that she was autistic, and 11 years later, with the help of ABA therapy, she's now speaking again. She still struggles with math and reading, and she has some motor skills that are a little off, and communication skills may be a little off, but she's doing a lot better. And this is a true story, is told by Michelle Trivedi on Autism Society's site, and it just shows you that there are autistic individuals everywhere, and it could be an everyday occurrence in your middle school. Your child's friend could be autistic. As of December 2009, it's found that 1 in 110 people has autism. That means that there's just a high prevalence. According to the Autism National Committee, 4 times more boys have it than girls, which means 1 in 70 boys is autistic. Autism Speaks, which is a science and advocacy organization, says that autism is more common than childhood cancer, juvenile diabetes, and pediatric AIDS combined. So that just shows you how important learning about autism really is. My mom works with autistic individuals in Hiram, Ohio, and I get to interact with them a lot. And I found it really interesting, some of the facts and treatments about autism, so I'd like to share it with you. Autism is a developmental disorder, which means that the brain does not completely develop in some areas, which could make other functions off with the person. And this means difficulty with social interaction and communication skills, behaviors, and so the National Institute of Neurological Disabilities and Stroke, which is NINS, says that autism is a autism spectrum disorder, and this could really be treated. And so they said causes would be, or symptoms could be described as impaired social interaction, which includes interpretation of others or expressing themselves, lacking empathy, which means you don't really know how to sympathize with someone or can't express your emotions, repetitive behaviors, which could be self-abusive, usually by frustration. You start speaking later. Actually, if a child doesn't start speaking by 3 years old, that usually is a good hint that they might have autism. And there's co-occurring conditions, which if you have autism, you might have another disease, or if you have another disease, you might be more likely to have autism. So now that we've covered behaviors and symptoms, we'd like to discuss causes, of course. And so 2 causes would be genetics and the environment. Genetics, according to NINS, there's irregularities in the brain, which I said, but that can involve neurotransmitters, serotonin levels, and just overall structure, which could impair social interactions with the people and thought processes. There's also, according to Autism Speaks, there could be inflammation in the central nervous system. There's studies going on about that, but that's a possible theory. And coexisting conditions, like I said before, Autism Society likes to bring up that there's that factor too. And also, Autism Society says that toxins could be a concern. In our environment, there might be factors, which there's studies going on about that too. But overall, there's no definite cause, but those are all thought to contribute, and there's studies on them. And so now that you know about what autism is and symptoms and what could cause it, now you want to know how to treat it, right? Well, there's 2 main types of treatment, behavior and the medications and supplements. Behavior is usually skill-oriented, which according to Autism Speaks, there's therapies such as ABA, which is applied behavior analysis, PRT, pivotal response therapy, RDI, relationship development intervention, AAC, Association for Science and Autism Treatment, the ASAT, said that there's AAC, the Augmentative and Alternative Communication, and all of those basically take an individual's interactions, try to teach them or show them ways to express themselves better or to adapt to situations. There's also family counseling, which according to NINS really helps a lot, and medications and supplements. Usually they are used to treat symptoms like depression, anxiety, and OCD, or there's special diets that are thought to help. There's not really proof on that, but the people taking care of them say that it usually helps. And there's vitamins, which according to ASAT, which is the Association for Science and Autism Treatment, that vitamin deficiencies could cause some problems too, so they use vitamin supplements. And I hope that that helps you think of the autistic individuals in society and help you understand better what they're going through and help you just think about all the people, 1 in 110 people now has autism. So what you could do to maybe help them interact with you or just understand what they're going through. Thank you.